Now, it appears as if we have somebody calling in already. Thank you so much. We have Brenda calling in from Las Vegas. We're going to go right to the phones right away. Hello, Brenda. Thanks for calling. How can I help?
I'm a victim of the system, and so I'm a great fan of yours. Let me try to be brief, and I'm not good at that, so interrupt me whenever you need to if I'm going on too long. I'm calling about carpal tunnel. About 10 years ago, I was diagnosed with carpal tunnel, and thank goodness at the time I was seeing an applied kinesiologist, et cetera, and he said, you don't have carpal tunnel. I went to the best neurologist in Las Vegas, Nevada, 2 different doctors. You have carpal tunnel. Scheduled surgery. Finally, the applied kinesiologist said, you don't have a carpal tunnel. You have thoracic outlet syndrome. I scheduled the surgery anyway, and he made me feel so bad. I canceled the surgery, went to therapy, let him treat me, beat the carpal tunnel, never had surgery. Now, that was 10 years ago. Now, in 2009, diagnosed with osteoarthritis. The doctor, when he finally told me, and after all the tests, you know the routine, I said, well, what do I do? He said, oh, you'll be fine. And let me go. I even called the Arthritis Foundation looking for what do I do about this. Did not know about you, did not know about Dr. Wallach, did not know about longevity. Okay. Now, long story short, I fought the fight. I did 4 months. By the time I got on your products, I was bone on bone, finally couldn't walk. I had hip replacement surgery. Now, I'm doing fine. I'm on products, and I'll give you the list if you want to know. But the reason I'm calling about carpal tunnel is it seems that it's back with a vengeance. And you know, the only thing they are telling me is an option is hand surgery.
All right. Well, how long ago? All right. Good. How long ago was the hip replacement surgery? When was that done?
It was September and October of last year.
All right. And when did the carpal tunnel come back?
About 2 months after the second surgery.
Okay,
Isn't that
very
right?
good.
It's strange.
No, it's not strange. It's predictable. That's why I asked the question, because here's the deal. Carpal tunnel is a nutrient deficiency, and it's a deficiency in a peculiar little mineral, a trace mineral called molybdenum. Molybdenum. M-O-L-Y-B. M like Mary, O-L-Y, B like baby, D like David, N like Nancy, E, N like Nancy, U-M, molybdenum. It's a peculiar little trace mineral, and when your body runs out of molybdenum, the little sheaths around the tendons in your wrists that keep the wrist lubricated dry out. And it's kind of like a rubber band. When it dries out, you know, it just isn't as flexible as it used to be, and it'll snap like a twig if you pull it too far. Well, it's the same thing. Now, surgery, and more specifically the drugs that they give you pre, during, and post-surgery, waste nutrients from your body. One of the side effects that nobody talks about with prescription medicines is that they waste vitamins, minerals, essential fatty acids, amino acids from your body. They burn them up. They burn right through them. They extract them from your body, and you pee them out. So most of the time, there are side effects post-surgery that the surgeon will tell you, of course, had nothing to do with it. Well, you know, like there's a saying, where there's smoke, there's fire. So when you get the return of an old symptom post-surgery, it's because the drugs that you took during the surgery ripped what little nutrients there were out of your body, and then the old condition flared up. So,
okay, let me tell you, I feel blessed because I did try for 4 months to avoid the surgery, and I have been a poster child for this surgery, but it's because I was loaded up on your product pre-surgery. Do you understand?
Yeah, well, that's correct. But, you bet I understand. Now, here's the deal. Sometimes the human body reaches a point of no return. Sometimes it does. And sometimes you need surgery because it's just too late. It's gone too far, right? But I don't know where that point of no return is. Before I started working with Dr. Wallach, I used to think I knew where it was, but I have seen such remarkable things happen on Dr. Wallach's protocols that, for goodness sake, I have no idea where the body's point of no return is. Now, there are only two conditions under which medical nutrition doesn't work. There's only 2 conditions. Well, 3. Either you're dead. That was a joke. The second thing is...
Okay, I'm laughing.
If you're not absorbing the nutrients or you're not taking enough of the nutrients, right? You're either not taking enough or you're not absorbing what you're taking. So everybody with a chronic health condition, especially if it's really bad like bone-on-bone arthritis, needs to be on the gluten-free diet. So are you on the gluten-free diet?
Not strictly.
Well, then that's part of the problem. No. It's got to be strict because here's the deal. I want you to visualize a bucket. And if that bucket contained all of the nutrients that your body needed, and, as if we were trying to fill that bucket up with water, which, in this example, is all the nutrients that your body needs. If there's holes in the bottom of the bucket, we're pouring water in the top, we're pouring nutrients in the top, and they're leaking out the bottom, right? So in order for medical nutrition to really work, you have to plug up the leaks in the body, so to speak. And what's mandatory in this case for you, and I mean mandatory like your life depended on it because it kind of does, you have to be 100% gluten-free. And I don't even want you downwind of anybody frying food. I don't even want you looking at fried food. 0 tolerance for fried food, 0 tolerance for wheat, barley, rye, and oat.